Welcome to 4 Family Caregivers. Today we're continuing our discussion on balance. We've had that for a while. Lots of different areas that help us to maintain our balance. Let's see, we've had Pat Vanenstiel this month talking about exercises. We've talked about medications, just all kinds of areas that we need to take a look at if we're going to keep our balance and keep from falling. And one of the important areas is our ears. And we have Dr. Barnes, who's with the Topeka Ear, Nose, and Throat. And you are one of our sponsors for our show also. So
very good.
We're glad to have you, and we've had several of your audiologists on before to talk about hearing. So welcome. We're glad to have you.
Great. It's a pleasure to be here.
And hear about the ear, because we know that it helps us in keeping our balance. And one of the things that so many people hear about anymore is talking about rocks in your head. Explain that to us a little bit.
It's an interesting question you ask. One of the most common types of dizziness that we experience is a thing called benign positional vertigo. The reason we call it benign positional vertigo is typically it goes away on its own. However, in many of our patients, it can be very long-lasting. We use the medical word recalcitrant, just not going away for a long, long time. When we talk about that, frequently use the word rocks in your head because in the inner ear, there are little calcium particles, if you will, that become malpositioned. And so they move out of the appropriate part of the inner ear into another part of the inner ear. When they do this, they cause stimulation of the inner ear and can cause very significant balance problems. For example, when someone looks up when they're in the shower, for example, or when they turn over in bed, they can experience these very short bursts of extreme dizziness. They feel, as I talk to my patients, they frequently describe when they turn over in their bed, they feel like they're going to be flipped off the bed, even though they realize cognitively with their mind, they realize that they're sitting flat on their bed, but they feel like they're being flipped off the bed. And that's what happens. That's the symptoms that people have when they have positional vertigo. So the thing that's exciting about positional vertigo is typically it's one of the semicircular canals that has the inappropriate particles in it, and through a maneuver we can actually get those little particles back into the correct part of the inner ear.
And is it usually older adults that have that?
Yes, it's common to happen in older adults, but we also see it in younger patients who have had some type of head trauma. People who have had head trauma have a higher risk of this as well because those little particles get shaken out of the inner ear.
But if you have that, that could be one of the things,
Absolutely.
Right?
In fact, that's probably the most common type of inner ear types of dizziness. Now, there are many other types of dizziness. Dizziness just describes feeling off balance, but as far as inner ear types of dizziness, one of the most common is this benign positional vertigo. And sometimes, again, we call it inappropriate rocks in your head.
Right. That's what we hear so much. And that's fairly easily treated.
Fairly easily treated. The thing that's exciting about it is in most patients, by doing this maneuver, it has several names. It was named after a physician named Dr. Epley.
And you were kind of closely associated
there
with that.
In a way, Dr. Epley, initially when he developed this procedure to treat this, many in the medical community thought that he was kind of crazy. And back in the 90s, several other groups of physicians, and one group, Dr. Welling, who I would describe as my mentor at Ohio State, he decided, let's try to duplicate these clinical studies, and he was able to do this along with a doctor in Canada named Dr. Barnes. And when both of those doctors were more, I guess, in the mainstream of academia, and once they were able to reproduce that, they went on to find Dr. Welling did a nice study and found those little inappropriate particles during some surgical procedures. So it's really neat that he was able to describe that. And I studied with him, was able to help do some publication.
That's great. So that's one thing. But we've got a picture here.
Yes, let's go ahead.
Why don't we put that up so you can show us a few more things that can happen?
Yeah,
I'm trying to get that. Is that okay with the camera there? A little bit more forward? Okay, there we go. All right.
What I thought I'd first show is this picture here. And the inner ear is composed of several areas. One of the areas is the cochlea, which is the hearing part of the inner ear. You also have the balance portion of the inner ear, and that includes these circular things called the semicircular canal, and those things code for rotational movement when our heads turn from side to side. Up and down and back and forth is coded by this central part of the inner ear called the utricle and the saccule. Now, the thing that we've just been describing, this is a nice little picture of the little otoconia, or the otoliths. And what happens in benign positional vertigo is these little otoconia move inappropriately into this back posterior semicircular canal.
Those go in this area.
Right.
Okay.
And through our maneuver, we're able to get those to float back. They are actually floating in fluid. We're able to float them back into the appropriate part of the inner ear. And that's what's neat about it. Now, sometimes we have a difficult time doing that in our office in 1 or 2 procedures, but afterwards we often send them to physical therapy if necessary too. So we have I think in treatment of inner ear disorders, you have to realize that it's not just ear, nose, and throat doctors, but it's a team approach that we use.
That's a lot of different things.
It is.
So that's the part of the ear that affects your balance.
Correct. Now, we've talked a little bit mostly about positional vertigo. There are other types of inner ear disorders. One of them that we see frequently in our patients that are 55 and older is a thing called vestibular neuritis. Now, vestibular neuritis, that's a big term, but it's often known as an inner ear infection. You may have heard people talk about an inner ear infection. When people have vestibular neuritis or an inner ear infection, we think that these nerves, this superior, the little yellow, this is the cochlear nerve that gives us hearing. These two nerves, the superior and inferior vestibular nerve, are the nerves that go to the brain, and they're important in our balance in the vestibular system. We think that either there's some inflammation in those nerves, or perhaps some inflammation within this area we call the labyrinth of the inner ear. And when that happens, people often describe dizziness that comes on very suddenly. Now, the vestibular neuritis, or this inner ear infection dizziness, typically will last for days, if not a week or longer. People describe a horrible spinning sensation, and it becomes quite difficult in some of those patients to distinguish that from stroke. So those patients frequently present to the emergency room wondering if they have a stroke.
So this is quick onset.
It can be very sudden, almost like it's flipping on a light switch. And those people can be very, very dizzy. They can feel sick to their stomach. They start having vomiting and just a horrible spinning sensation. Frequently, those patients, some of them go home, but some of those patients are admitted to the hospital. Further tests are done to make sure that there's not a problem with the blood supply to the brain, the brainstem, those kinds of things. Once those stroke items have been ruled out, then treatment is given, and frequently they're referred to us either in the hospital or after that for further treatment.
Because dizziness is not an easy thing to deal with.
It's not. It's pretty complex.
Oh, yeah.
The other thing that we sometimes see is other types of inner ear things. Now, this is less common. This is a thing called Meniere's disease.
A few seconds. So Meniere's,
Meniere's is another inner ear kind of thing that can happen too. Obviously, that would take a lot to talk about that too.
And that keeps going for a long time, doesn't
it?
Well, and that's chronic.
Correct. That's more of a chronic thing. But the two things we've talked about that are more common in this population are the vestibular neuritis and the positional vertigo.
So if you're dizzy and haven't found anything out, you might want to go see Dr. Barnes. So
thank you.
Thanks for being with us today. We really appreciate it. And thanks for being with us on 4 Family Caregivers.